This is All India Radio. We now bring you a special news program on COVID-19. Good morning, I'm Valsa Williams and with me is Sunil Verma. The headlines. Prime Minister Narendra Modi emphasizes the importance of restarting the economy along with fight against COVID-19. Health Minister Harshvardhan asks AIIMS and other premier medical institutes to take proactive measures to combat the pandemic. No new case reported from 85 districts in 25 states and union territories for the past 14 days. CBSE to conduct remaining class 10th and 12th exams after lockdown. And Uttar Pradesh government to create quarantine facilities for almost 15 lakh people, keeping in mind the return of migrant workers. Prime Minister Narendra Modi has emphasized the importance of restarting the economy along with the fight against COVID-19. He suggested that the country will need to focus on a two-pronged approach to preserve public health and revive economic activities. The Prime Minister was interacting with chief ministers through video conference on the COVID-19 situation yesterday. He said the nationwide lockdown since March the 25th has yielded positive results and managed to save thousands of lives. The Prime Minister underlined the need to give due attention to the economy as well. Prime Minister Modi called for using the crisis to push for various reforms. He called upon states to firm up the standard operating procedures for restarting manufacturing in a graded manner in green zones. Union Health Minister Dr. Harshvardhan has directed authorities of All India Institute of Medical Sciences, AIIMS, and other premier medical institutions to take proactive measures to combat COVID-19 in their respective states. He also asked them to create awareness in society that there should be no stigma related to COVID-19 patients and frontline healthcare workers. Dr. Harshvardhan held a video conference yesterday with medical directors of AIIMS Delhi, Regional AIIMS, Jawaharlal Institute of Postgraduate Medical Education and Research, Puducherry, and Postgraduate Institute, Chandigarh, to review the preparedness on coronavirus. A senior official said that AIIMS Delhi has specially been asked to create awareness material for people on stigma-related issues on coronavirus.
The Health Ministry has issued guidelines for home isolation of people who either have very mild COVID-19 symptoms or are in the pre-symptomatic phase. Such patients with requisite self-isolation facility at their residence will now have the option for home isolation. In order to be eligible for home isolation, patients must have a caregiver at home to provide care on 24/7 basis. A communication link between the caregiver and the hospital is a prerequisite for the entire duration of home isolation. The caregiver and all close contacts of such cases should take hydroxychloroquine prophylaxis as per protocol and as prescribed by the treating medical officer. They also need to download the Arogya Setu app on mobile. The patients must agree to monitor their health and regularly inform health status to the district surveillance officer for further follow-up by the surveillance teams. They are also required to fill in an undertaking on self-isolation and follow home quarantine guidelines. Immediate medical attention must be sought if serious signs or symptoms develop. These include difficulty in breathing, persistent pain or pressure in the chest, mental confusion, or developing bluish discolorations of lips or face. The home isolation will end when symptoms are clinically resolved and the surveillance medical officer certifies the patient to be free of infection after laboratory testing.
In our series Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Talking to AIR News, Dr. Uma Kumar, Head of Rheumatology Department, AIIMS, suggested to people to maintain social distancing as it is very important to check the spread of the virus.
It has been very, very effective, and this has also given people time to understand why it's important to change their behavior, like hand hygiene, use of face mask, cough etiquette, social distancing or physical distancing, right? So, and they'll understand that this virus is going to remain here for some time and they need to change their practices.
Dr. Rakesh Garg of AIIMS, Delhi, said that if a person comes in contact with an infected person, then he or she should be self-quarantined.
जिनको पॉसिबिलिटी है होने के चांसेस हैं वो अपने आप को आइडेंटिफाई करें, अपने आप को सेल्फ रिपोर्ट करें, अपने आप को सेल्फ क्वारंटाइन करें, तो एक बहुत बड़ा सपोर्ट रहेगा इस कोविड-19 के स्प्रेड को कंट्रोल करने में, कंटेन करने में.
In the wake of the COVID-19 pandemic, food and nutritional care play a very important role for people to keep themselves fit and maintain immunity of the body. Talking to AIR News, Dr. Anupa Sidhu, Director of Department of Food and Nutrition, Lady Irwin College, New Delhi, said people should take fresh and well-cooked food and avoid junk food.
फ्रेशली कुक्ड फूड खाना है और ताजा बना हुआ 2-3 घंटे के अंदर सुबह शाम. इसमें कोई लोड नहीं होना चाहिए बैक्टीरिया या वायरस, और फ्रिज में एज फार एज पॉसिबल अवॉइड करना चाहिए, क्योंकि अगर कोई लोड होता है तो बहुत देर तक फ्रिज में वो रहता है. एंड जो भी कुक करे वो अपने आप को कवर करे, और कवर करके कोई वायरल शेडिंग उस इंसान की नहीं होनी चाहिए. अगर वो कोविड पॉजिटिव नहीं भी है तो भी नहीं होनी चाहिए. एज फार एज पॉसिबल अवॉइड आउटसाइड फूड, क्योंकि उसको किसने बनाया है, उसका हाइजीन की क्या अंडरस्टैंडिंग है.
A total of 28,380 confirmed cases of COVID-19 have been reported in the country so far. Out of the total cases, 6,361 patients have recovered and been discharged from the hospitals, while 886 patients have died. Briefing media in New Delhi yesterday, Health Ministry officials said that recovery rate of patients is improving and now it stood at 22.17%. He said 16 districts in the country which earlier had cases have not reported any fresh case in the last 28 days. He informed 3 new districts which were added to this list are Gondia in Maharashtra, Damargere in Karnataka and Lakhisarai in Bihar. He further said a total of 85 districts from 25 states and union territories have not reported any new case since the last 14 days.
टोटल ऐसे 85 डिस्ट्रिक्ट हैं 25 स्टेट्स और यूनियन टेरिटरीज में, जहां पर कि पिछले 14 दिनों से कोई केस रिपोर्ट नहीं हुआ है. यह हम लोगों को जानना होगा, फॉलो अप करना पड़ेगा कि हम अपनी विजिल को कॉन्स्टेंटली उसी मोमेंटम से बनाए रखें ताकि इन डिस्ट्रिक्ट की संख्या बढ़े और इन डिस्ट्रिक्ट में कोई नया केस ना आए.
The Health Ministry official said, due to stigma and fear, many times patients try to hide and avoid seeking timely treatment, and this situation does not only bring harm to the patient but also harm to their family and to the whole society. He said the battle is with the disease and not with a person suffering from COVID-19.
कोरोना ग्रसित होना कोई स्टिग्मा नहीं है. जितनी जल्दी सच्चाई का सामना होगा उतनी जल्दी ही और उतने ही अप्रोप्रिएट तरीके से उसका समाधान होगा. एक मुख्य अंश के रूप में माननीय प्रधानमंत्री जी ने ये भी कहा कि इस समय में अन्य आरोग्य सुविधाएं जैसे कि डायलिसिस, अन्य बीमारियां, उनके ट्रीटमेंट आदि में भी कोई ढिलाई ना होने दें. परंपरागत मेडिकल व्यवस्था सुचारू रूप से चलती रहे. रेड जोन से ऑरेंज जोन, ऑरेंज जोन से ग्रीन जोन में जिले को ट्रांसफॉर्म करना ही हमारा मंत्र होना चाहिए.
He said we have to understand that there is no risk of transmission from recovered patients, and in fact they can be a potential source of healing for antibodies using plasma therapy.
On the issue of rapid testing kits, the Health Ministry official clarified that ICMR has followed due process to finalize tenders for purchase of rapid testing kits based on sensitivity and specificity. He said when complaints from the field arose, ICMR reacted promptly and cancelled the orders and no payment was made to the vendors. The official added that ICMR has sufficient number of testing kits for conducting RT-PCR COVID-19 tests as per our testing strategy. The Home Ministry official said till the 26th of this month, over 80% wheat crop has been harvested and 80% mandis in the country have started operations. She added that Manrega operations and construction are ongoing throughout the country, providing employment to agricultural and migrant labour during this period. She said more than 2 crore people have got employment under MG Narega.
मनरेगा के तहत भी कार्यों ने गति पाई है. वाटर कंजर्वेशन और इरिगेशन जैसे लार्ज कम्युनिटी एसेट्स पर भी मनरेगा के तहत काम शुरू हो गया है और 2 करोड़ से ज्यादा श्रमिकों को रोजगार प्राप्त हुआ है. सर्वे के अनुसार लगभग 60% फूड प्रोसेसिंग यूनिट्स ऑपरेशनल हो गई हैं. स्पेशल इकोनॉमिक जोन्स में 2,825 इकाइयां और इसके अलावा 350 एक्सपोर्ट ओरिएंटेड यूनिट्स भी क्रियाशील हो चुकी हैं।
During the briefing, the chairman of the Empowered Group 5 on supply chain gave a presentation on the progress in supply chain and logistics of essential items. He pointed out that the prices of potato, onion and tomato are largely stable during the lockdown period.
If you look at prices of tomato, onion and potato, they have been largely stable during the lockdown. 1.5 crore लोगों को daily cooked meals दिया जा रहा है. So this has been a huge effort, a collaboration between government, between the NGOs, the private sector. If you look at supply of milk and LPG cylinders, this is almost the same as pre-lockdown levels. So there's been very little disruption. In fact, they have met all their targets.
Procurement of wheat is progressing at a very fast pace in all major procuring states of the country. A quantity of 88.61 lakh metric tons LMT wheat has already been procured for the central pool till 26th of this month. Ministry of Consumer Affairs in a statement says that going by the present pace of procurement, the target of procurement of 400 lakh metric tons for the season is likely to be achieved. Considering the looming threat of spread of COVID-19 virus, procurement is being undertaken after taking enough precautions and ensuring social distancing in the mandis. More from our correspondent.
Food Corporation of India has dispatched 58.44 lakh metric tons food grains to meet the requirements under various schemes of government. It is expected that with gradual easing of restrictions by central and state governments, the pace of unloading will be enhanced further in the coming days. Lifting of free food grains to be distributed under Pradhan Mantri Garib Kalyan Ann Yojana is also progressing well. Under the scheme, 5 kilograms of food grains are being distributed to the eligible persons for 3 months. FCI has made arrangements to position adequate stocks in all states to meet the requirements. With Dipendra, Suparna Sekia, AIR News, Delhi.
This is All India Radio bringing you a special news program on COVID-19. Let's take a look at the headlines once again. Prime Minister Narendra Modi emphasizes the importance of restarting economy along with fight against COVID-19. Health Minister Harshvardhan asks AIIMS and other premier medical institutes to take proactive measures to combat the pandemic. No new case reported from 85 districts in 25 states and union territories for the past 14 days. CBSE to conduct remaining class 10th and 12th exams after lockdown. And Uttar Pradesh government to create quarantine facilities for almost 15 lakh people, keeping in mind the return of migrant workers. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Krishna दर्शकों का पसंदीदा धारावाहिक श्री कृष्ण जल्द आ रहा है डीडी नेशनल, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। फ्री डिश 001, टाटा स्काई 114, एयरटेल 148, सन डायरेक्ट 302, वीडियोकॉन D2H 149, डिश टीवी 193 और डेन 138। आगामी आकर्षण धारावाहिक श्री कृष्ण। लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। DD 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन DTH 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
अथ श्री महाभारत कथा।
Welcome back. The CBSE will conduct the remaining Class 10th and 12th exams after the lockdown. This was disclosed by Union Human Resource Development Minister Ramesh Pokhriyal Nishank yesterday. He said as soon as the national lockdown is lifted and the situation returns to normal, the government will announce the schedule for holding the CBSE examinations in the country. The minister was replying to a question while interacting with parents from across the country online. The HRD minister advised parents not to force children to study the entire day and let them study with a free mind. He said the CBSE will soon begin evaluation of papers which have already been conducted. A total of 190 new confirmed cases of novel coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 3,108 in the capital city. The Delhi government has confirmed that 877 patients have been cured and discharged so far, and 54 deaths have been reported in the national capital. A total 39,911 tests have been conducted so far.
The Delhi government has extended its list of cluster containment zones to 99 to contain the spread of COVID-19. Area extended from Nirankari Gali, Nakshara Gali, Nala Boring Gali, Ravanwali Gali, Jamila Masjid Bauli, Dargah Gurdwara Gali, Thane Gali, Terminal Gully and parts of Pilanji village were the new additions to the list of containment zones in the national capital. Orders have been given to seal the demarcated zones under the Operation Shield of the Delhi government. Prime Minister Narendra Modi has lauded Delhi police for its gesture to pay respect to the work being done by the Gurdwara Bangla Sahib in the national capital in the service of the people during the pandemic. Yesterday, in a unique way, Delhi police performed a siren parikrama around the famous Gurdwara as a token of appreciation for the people who have been distributing langar and providing other services in this hour of crisis. Commenting on it, the Prime Minister tweeted saying, Gurdwaras have been doing exceptional work in serving people and their compassion is appreciable.
The Uttar Pradesh government will prepare quarantine facilities for almost 15 lakh people in the coming days so that the migrant workers who will return from other states can be accommodated there. The government has also started the process of sending around 10,000 students living in Prayagraj to their homes in a phased manner. More from our correspondent.
Additional Chief Secretary Home Avnish Awasthi said that special quarantine hubs will be established in all the 75 districts of a state, which can accommodate 15 to 20,000 people each. In this way, the capacity of all the quarantine centers is estimated to range from 10 to 15 lakhs in the state. The authorities will also help the students of other states stuck in Prayagraj. A fleet of 300 buses with police escort will take the students back to their native districts in phases. Sushil Chandra Tiwari, AIR News, Lakh.
Chief Minister of Uttar Pradesh Yogi Adityanath will talk to students today who were recently brought back from Kota in Rajasthan by the state government. In this meeting, through video conferencing, the Chief Minister will discuss various issues with the students, including proper completion of lockdown period, creating awareness among general public regarding the pandemic, and use of online education in shaping their future. Bihar reported its highest single-day surge in corona-positive cases yesterday. 69 people tested positive for COVID-19 yesterday, taking the total number of cases to 346 in the state. Maximum 90 positive cases are from Munger, followed by 39 in Patna and 35 in Nalanda. 287 patients are undergoing treatment in various hospitals. 57 people have recovered so far.
In Jharkhand, with 20 COVID-19 positive cases detected in a single day, total toll in the state has gone up to 103. 17 patients have recovered and 3 have died due to coronavirus infection in the state. 11 districts out of 24 have been affected with the coronavirus pandemic. The borders of Ranchi districts have been sealed completely, with no movement being allowed without permission. Odisha Chief Minister Naveen Patnaik has announced an ex gratia of 15 lakh rupees to the family members of the working journalists who die of COVID-19 infection while performing their duty. A statement released by Chief Minister's office said the journalists are sincerely carrying out their responsibility by creating awareness about the virus. If a working journalist dies of the virus, the state government will provide 15 lakh rupees ex gratia to the kin. Earlier, the Chief Minister had announced an assistance of 50 lakh rupees for the family members of medical and healthcare officials and members of support services who died during the battle against COVID-19. The state will treat them as martyrs and accord a state funeral.
The Interministerial Central Team IMCT has extended its visit by one day in Telangana. It is taking stock of the COVID-19 situation in Hyderabad. The team will visit a few more spots in Hyderabad and some other places today. A report.
The visiting central team is having a close look at treatment methods, facilities to patients at hospitals and quarantine centres, besides inquiring about the methods being followed in containment zones and assessing the lockdown impact on normal people in Hyderabad. The team inquired about the availability of sufficient sanitation, paramedical and security staff at the hospital, number of beds, ICU facilities, ventilators and safety measures for doctors and staff. Earlier, the central team met senior officials including State Chief Secretary Somesh Kumar, DGP Mahendra Reddy and inquired about the measures being taken to contain spread of virus and visited few local markets to inquire maintenance of social distancing and transportation of essential commodities and their prices. Lakshmi, AR News, Hyderabad.
In Tamil Nadu, 81 patients were discharged from hospitals yesterday, while 52 new cases were recorded. The death toll remains at 24 as there is no report of loss of life during the last 24 hours, though the total number of infected cases has mounted to 1,937. The active cases remain at 809. The Interministerial Central Team members met the Tamil Nadu Chief Minister Edapadi Palanisamy at the Secretariat yesterday. More from our correspondent.
An interesting fact is that the number of infected male is more than twice as that of female, a pattern that is being looked into by analysts. Of the 111 infected children below 12 years of age, most of them have been cured and discharged, and the remaining children are reportedly stable. The testing has increased to nearly 7,200 samples yesterday. Meanwhile, taking advantage of the financial incentives announced by the state government, 42 companies have newly started production of ventilators, personal protective equipment, medical tools and medicines useful for the treatment of COVID-19. Jai Singh, AR News, Chennai.
Maharashtra Health Department has informed that 7,861 squads have completed surveillance of 32.28 lakh population in 572 active containment zones across the state. With 522 new positive cases in the state, the total number of corona cases has gone up to 8,590, of which 1,282 patients have been discharged and 6,939 are active cases. More from our Mumbai correspondent.
The number of people recovered from the viral infection increased by 118 on Monday to taking the total number to 1,015. Among the 395 new cases detected in Mumbai, Dharavi alone, a COVID-19 hotspot, reported 13 new cases, taking the tally in the slum-dominated area to 288. The Brihan-Mumbai Municipal Corporation informed that it was planning to start a 1,200-bed dedicated Corona Healthcare Center at Nesco grounds at Goregaon with the help of a private company and Maharashtra Chamber of Housing Industry CREDAI. In this facility, 1,000 beds will be equipped with oxygen support. Sonali Ghadiyal Patil, AIR News, Mumbai.
10 Indonesians, including 6 women who had attended the Tablighi Jamaat's religious meet at Nizamuddin in Delhi last month, have been arrested by the Mumbai police under various sections of the IPC. They were arrested on completion of their quarantine period. An official said that these 10 were part of a group of 12 Tablighis from Indonesia and were staying at an apartment in suburban Bandra since March 29th after they had returned from Delhi. The official said the police came to know about the presence of the Indonesians in Bandra only on April 1st.
In Gujarat, 81 people were discharged from various hospitals during the last 24 hours. 72 out of 81 discharged patients were from Ahmedabad alone. With this, the total number of discharged persons in the state has gone up to 394. With the 247 fresh cases, the total number of COVID-19 cases in the state has gone up to 3,548. A report.
Principal Secretary of Department of Health Dr. Jayanti Ravi said the rate of recovery in the state is improving gradually. She said around 2,960 active patients of COVID-19 are completely stable, while 31 are on ventilator. Congress MLA Imran Khadiwala was also discharged from the hospital yesterday. He donated his plasma for the plasma therapy. 18 districts in the state have single-digit cases, whereas no case has been reported from 3 districts. The state DGP Shivanand Jha said the last phase of lockdown is more critical and urged people to follow lockdown more seriously. Meanwhile, Surat Collector Office started issuing vehicle passes for the stranded migrant workers. Aparna Kut, AR News, Ahmedabad.
In Rajasthan, the number of COVID-19 infected people have gone up to 2,262, with 77 new persons found positive yesterday. 50 people have died due to COVID-19 in the state so far. More from our correspondent.
The number of infected people has crossed 800 in Jaipur, while in Jodhpur, 375 persons have been tested positive so far. More than 100 cases have been reported in Ajmer, Bharatpur, Kota, Nagaur and Tonk. Curfew has been imposed in more than 90 police station areas of 20 districts of the state. Lockdown is being strictly implemented across the state. More than 13,000 people have been arrested for breaking the law. Jitendra Dwivedi, AIR News, Jaipur.
In Madhya Pradesh, the total number of COVID-19 cases has gone up to 2,330, with around 200 new cases reported in the last 24 hours. 110 patients have died so far, while 357 patients have been cured and been discharged from the various hospitals. Indore has become the hot spot of COVID-19, where the total number of cases has gone up to 1,372. Bhopal is second with 428 corona-positive cases. Gram Panchayats in Madhya Pradesh have come forward to help poor families and migrant labourers. A report.
Additional Chief Secretary Manoj Srivastav said that 8,70,000 labourers have been provided delicious food in 22,812 panchayats. Apart from that, 4 kg wheats and 1 kg rice per person have also been provided to 1,92,000 beneficiaries so far. The Panchayat Raj Directorate had already issued instructions to the sarpanches of all the Gram Panchayats that they can use their funds as well as funds given by the central government to ensure food to the poor families of the village. Sanjeev Sharma, AIR News, Bhopal.
Banks in Poonch are witnessing a rush of customers these days. Farmers whose accounts have been credited with 2,000 rupees each under PM Kisan Samman Nidhi Yojana and women whose accounts are credited with money for purchase of LPG cylinders under Prime Minister's Ujjwala scheme are withdrawing the money. They expressed happiness.
नाम मोहम्मद अकरम है और जुलास का रहने वाला हूँ। तो अभी जो पैसा पाइए हमको मिल रहा है और मोदी जी का बड़ा शुक्रिया है कि इस मौसम में और इस सीजन में हमारी फसल की कटाई है और जैसे मक्की की बिजाई आ गई, अब उसमें खेती बाड़ी में काम करने की उन्होंने परमिशन दे दी। मेरा नाम अल्ताफ हुसैन है, मैं पुंछ का जुलास का रहने वाला हूँ। मैं मोदी जी का बहुत बहुत शुक्रिया अदा करता हूँ कि जो आज उन्होंने हमारे अकाउंट में 2-2 हजार रुपया डाला है। हम गरीबों का किसानों का बहुत बड़ा फायदा है इसमें।
And now an overview of today's newspapers covering COVID-19 stories. Modi, CM's brainstorm over lockdown 3.0. Plan exit but stay vigilant, PM tells chief ministers, headlines mail today. PM puts emphasis on economy, writes the Financial Express. The paper also adds, no cut in states' tax share till January. The Pioneer notes, Delhi government likely to announce some relief in the lockdown situation on May 1st. Incentives, tariff protection and plan to push Make in India. The government is planning to encourage local entrepreneurs to take on multinational e-commerce giants is a front page story in the Hindustan Times. Doing a Trump, states build walls, trenches on borders in an attempt to seal themselves off from neighbours, reports the Times of India. Workplaces won't be sealed if COVID cases found, the Economic Times quotes officials. Sanitization of premises and quarantining of affected person and contacts to be enough. And finally, the Hindu reports, post-recovery, Tabligis donate blood plasma. Around 300 have volunteers to join COVID fight.
And now before we end the program, the headlines once again. Prime Minister Narendra Modi emphasizes the importance of restarting the economy along with fight against COVID-19. Health Minister Harshvardhan asks AIIMS and other premier medical institutes to take proactive measures to combat the pandemic. No new case reported from 85 districts in 25 states and union territories for the past 14 days. CBSE to conduct remaining class 10th and 12th exams after lockdown. And Uttar Pradesh government to create quarantine facilities for almost 15 lakh people, keeping in mind the return of migrant workers. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the special news program on COVID-19.